Okay, today we discussed the pharyngeal muscle. Basically, we already discussed the different parts of pharynx, which is nasopharynx, which is behind the nasal cavity. Behind the nasal cavity is the nasopharynx, and the nasal cavities, even nasal cavities means the right and left nasal cavities, and pharynx, the part of pharynx which is behind the mouth cavity, oral cavity, is the oropharynx, and the part which is behind the laryngopharynx is the laryngo behind the larynx is the laryngopharynx. We know that there are some important structures present in these parts, like in nasopharynx we have a eustachian tube. We have eustachian tube. Like oropharynx we have arches, different arches and folds, which consist of tonsils. Basically these are the palatine tonsils. We have a palatine tonsil in oropharynx and other. Along with these things, we already know that there are six muscles which are present at one side, and six pharyngeal muscle is present on other side. A total muscle of pharynx are 12 numbers. We have total six pairs of pharyngeal muscles in the pharynx. These pharyngeal muscles are classified like: number one, three pairs are circular muscles. We have three pairs of circular muscles, and we have three pairs of longitudinal muscles. These circular muscles are basically are: number one, very easy, that is the superior. Number two is middle. Number three is inferior. Constrictor muscles. These are three constrictor pharyngeal muscles. ठीक है. Now we have longitudinal muscles. In the longitudinal muscle, first of all we have a salpingopharyngeus muscle. Salpingo mean is tube-like. Number two, we have palatopharyngeus muscle. Number three is stylopharyngeus muscle. We have some important facts about these muscles, which are very important to discuss before the start of origin and insertion of these muscles. We discuss some important facts so we easily memorize these muscles. All of these muscles are supplied by a vagus nerve, that is the 10th cranial nerve. Vagus nerve, we know that vagus nerve is the 10th cranial nerve, and through vagus nerve, through pharyngeal plexus, we have the pharyngeal plexus, except one muscle which is not supplied by this vagus nerve, which is the stylopharyngeus muscle, which is supplied by, this muscle is basically supplied by nerve which is ninth cranial nerve. Ninth cranial nerve is glossopharyngeal nerve. Glossopharyngeal nerve. Now, now we have another fact. These muscles help in the process of swallowing. In the process of swallowing, these muscles also help in elevation of larynx. In elevation of larynx, when the larynx is elevated, the epiglottis go downward during the process of swallowing. Therefore the larynx is tightly closed. Now we discuss the origin and insertion of these basically 6 pairs of muscles. 6 present on right side, 6 present on the left side of the medial line, that is the pharyngeal raphe. Number 1, we have the very important structure, that is the base of skull. On the base of skull there is a important foramen, biggest foramen, that is the foramen magnum. Foramen magnum is present. In front of foramen magnum we have an tubercle. This tubercle is called as pharyngeal tubercle. Pharyngeal tubercle give an origin to a fibrous band. This band is called as median fibrous band. As we know that median word is used to those structure which is present in the midline. So median fibrous band, we have a median fibrous band which started from the pharyngeal tubercle and down into the neck. Along the pharyngeal muscles, according to the pharyngeal muscles, 6 are present here and 6 are present on this side. Now, on the base of skull there is another important structure which is called as a median pterygoid plate. At the end of medial pterygoid plate there is a humulus. You see that there is a medial pterygoid plate, medial pterygoid plate, and this is called as pterygoid process, and the hook like structure present here is called as a humulus. We also know that below this base of skull we found a very important structure, bony structure, is the mandible. We have here the mandible. On the mandible we have important line, which important line is present on mandible, that is the mylohyoid line. Mylohyoid line is present on the mandible. Mandible is attached with the medial pterygoid plate of sphenoidal bone through a ligament which is called as a pterygomandibular ligament. This ligament is called as a pterygomandibular ligament. Now see the origin and insertion of first circular muscle, that is the superior constrictor muscle of pharynx. That muscle is originated right from here and inserted on this point. Originated and inserted. Origin and insertion we got. You see that the origin is from pterygoid process of sphenoidal bone. Then we have origin of some muscle fiber from the pterygo mandibular ligament, and then from a mylohyoid line. Mylohyoid line. You see that this is the superior constrictor muscle. Superior constrictor muscle, and this muscle is inserted on this median fibrous band. Then we have another important structure in the midline. Below the mandible, we have a thyroid. We have a bone that is called as a hyoid bone. This is the hyoid bone. This is the lesser and this is the greater horn and lesser horn of hyoid bone. From the greater and lesser horn, we have an origin of another muscle which is also inserted on this fibrous band. This is an insertion of muscle. Which muscle? Superior. Next to the superior is the middle constrictor muscle. Middle constrictor muscle. Middle constrictor muscle is originated from the greater and lesser hyoid horn of the hyoid bone and inserted on this median fibrous band. Then we have another muscle, and below this hyoid bone we have an important structure which is called as thyroid cartilage of larynx. Thyroid cartilage, on the thyroid cartilage we have an oblique line. From below the thyroid cartilage, we have another cartilage of larynx which is called as the cricoid cartilage of larynx. From these two important cartilages, muscle is originated that is called as a inferior constrictor muscle. Right, you can easily identify an important line, oblique line present on the thyroid cartilage, and then the sum of fiber originated on from the cricoid cartilage of larynx. Now, this is called as inferior constrictor muscle, but you also name this muscles from their origin. Like this, these muscle fibers originated from the thyroid cartilage. You can easily say this portion of muscle is called as a thyropharyngeus muscle. Pharyngeus muscle. Thyropharyngeus muscle, and the fibers which originate from the cricoid cartilage, this portion is called as a cricopharyngeus muscle. Cricopharyngeus muscle. Right, these are the circular muscles on the both side, and if you concentrate on their structural formation, you see that there is a narrow origin, broader insertion. It's like a wing shape. All of these muscles are supplied by a pharyngeal plexus through a vagus nerve. You can see these muscles, but we have some important spaces found on the base of skull. This is the base of skull, and the superior constrictor muscle. We found this space. In this space, we have an tube which is called as Eustachian tube. This is called as a Eustachian tube or auditory tube, which opens on the lateral wall of pharynx, nasopharynx, and continue or attach the tympanic cavity. Okay, now we have an important artery here. That artery is called as superior ascending palatine artery. Ascending palatine artery, ascending palatine artery, which is the branch of ascending palatine artery, which is the branch of facial artery. This is the facial artery. This is your facial artery. This is the facial artery. Then in this space, in the same space, we have an muscle. There are two muscle basically. One is called as a tensor palatine muscle, and in this space we have a three important structure: artery, eustachian tube, and muscle. And then we have another space which is right between the superior constrictor and middle constrictor, right here. In this position we have an important muscle here, which is called as a stylopharyngeus muscle. This is the stylopharyngeus muscle. Stylopharyngeus muscle. Stylo, as the name indicates, comes from the styloid process. Styloid process which is present on the base of skull, and these muscle fiber goes to the oblique line of thyroid cartilage. Another muscle right here, and there are another muscle which is called as a salpingopharyngeus muscle. Salpingopharyngeus muscle. The fiber of salpingopharyngeus muscle originated from the eustachian tube, goes down and united with the fiber of stylopharyngeus muscle and inserted on the posterior border of thyroid cartilage. Then we have a palatopharyngeus muscle. Palato, as the name indicate, originate from the palatine process. Palatine process, it is originated from the palatine process. If this is the palatine process, the fibers originated and united with these fiber and inserted on the posterior border of thyroid cartilage. These are very important muscles which are pharyngeal muscle, which help in the process of swallowing and elevation of larynx. How elevation of larynx? These longitudinal muscle, these three longitudinal muscle, this muscle that originate from the palatine process, that this is called as a palatopharyngeus muscle. The muscle comes from the styloid process of base of skull. You got stylopharyngeus muscle, which is also attached with the thyroid cartilage. Then we have a muscle from the eustachian tube and then inserted on the posterior border of thyroid cartilage of larynx. When these three muscles constricted, these constrict, then larynx is pulled upward, elevated. So the epiglottis comes downward and larynx goes upward. It closes the inlet of larynx during the process of swallowing. And I want to explain a membrane which is between the a membrane between the hyoid bone and this structure is called as thyroid cartilage. Hyoid bone and thyroid cartilage, there is a membrane which is called as a thyrohyoid membrane. Thyrohyoid membrane. In the center, it is double folded, therefore it is called as a ligament. Membrane is double folded, called as a ligament. On the periphery, there is a membrane, single membrane. This membrane is perforated by or preceded by a two important structure. One is the nerve, which is called as internal laryngeal nerve. Internal laryngeal nerve. And other important structure is the artery. Which artery? That artery is called as a superior laryngeal artery. Superior laryngeal artery. You found in this space, the space between the middle constrictor muscle and the inferior constrictor muscle, you found a membrane. That membrane is called as a thyrohyoid membrane, which is further preceded by a two important structure, internal laryngeal nerve and superior laryngeal artery. This is important structure, and we discuss these structures very easily, muscles, in this lecture. Inshallah, soon we will go for the lecture of larynx. Wa akhiru da'wana alhamdulillah.